Hello, everyone, and thank you for joining us. My name is Eric Katz, and I'm a senior correspondent at Government Executive, the titular division of Government Executive Media Group. Thanks a lot for attending today's virtual event, Testing Government's Connection, the Work from Home Digital Summit. Today's Digital Summit will explore and has explored already how the at-home government workforce is solving today's challenges and what the future may hold. Before we get started, I just want to go over a few housekeeping items. At the bottom of your screen, you'll hopefully see a Q&A button that allows you to ask questions for the speakers. We'll be fielding those towards the end of the program. But feel free to submit questions at any point along the way as you come up with them. If you experience any technical difficulties, just click the help icon and a member of our support team will assist you. This session is titled The CARES Act Impact. The CARES Act, I'm sure you all know, allocates funding for federal agencies to adjust and react to COVID-19. This session will explore how agencies can and will use their funds to support their workforce throughout the pandemic. Joining me for this session is Sheena Burrell. She's the Deputy Chief Information Officer at the National Archives and Records Administration. Sheena, thank you for being here. And Jessica Bongiorni, who is the Chief Human Capital Management, Chief of Human Capital Management at the Veterans Health Administration. So thank you everybody for joining us, especially Sheena and Jessica for helping us dive through some of these issues. And I'm going to get started here. Jessica, I'm going to start with you. VA, obviously, and VHA in particular have a monumental responsibility during this pandemic. And part of the response that has been bringing on more staff. So how has the CARES Act helped you there in terms of hiring, and what successes have you seen in implementing it on that front?
Thanks, Eric. The CARES Act has had a big impact on the VA. We got a huge amount of funding in order to support our response to the coronavirus, on the order of $19 billion, billion with a B. And we are using the bulk of that is for the Veterans Health Administration for a variety of things, including addressing issues in our community living centers or nursing homes, grants for state home construction, and using it for things like making modifications to our facilities so that we can better address what's going on to keep people safe. We also got a specific provision in the CARES Act, Section 20008, that was specific to VA and allows us to waive most pay caps for employees. And that is a real help to us in our ability to recruit and retain, because one of the challenges we face in VHA in the best of times is that we are competing directly with the private sector for healthcare talent. And that market has been a tight labor market for quite some time. And of course, we have caps and restrictions on the amount we're able to pay based on a variety of regulations and statutes, depending on how people are appointed. And with this section of the law during the pandemic, as long as the national emergency has been declared, we are able to waive aggregate pay limits, annual pay limits, premium pay limits, et cetera, for various occupations in order to help us get people in and keep them. So it's been a help to us in order to make sure that we're really able to boost our hiring numbers and get some of those occupations where we have a challenge in competing for talent as far as how they're compensated. We've made a lot of other changes to how we're doing recruitment and retention that aren't specifically due to CARES Act, but that provision has been a huge help to us.
Sheena, I'm going to get to you in just one second, but I want to follow up with you, Jessica, on that point. What does recruiting look like during a pandemic, and retention as well, I imagine a lot of the traditional sort of outreach and recruiting efforts that you would take part in are not possible due to the circumstances. So how do you do that outreach now? What does that look like? What successes have you found there?
Sure. So it really has shifted our plans for how we think about recruitment. So prior to the pandemic starting, we were already embarking on a large-scale plan to really tackle time to hire in VHA. It's a critical thing for us to look at so that we can be competitive with private sector. And as everybody knows, across government, time to hire is a challenge. We tend to take a lot longer than our competitors to get people in the door. So VHA was trending around 90 days for time to hire, which is a little bit better than the government average, but is not remotely where we needed to be. And so what was important for us is to look at how do we get the message out for a surge to get people on board and then also bring them on quickly. So we did a lot of recruitment marketing that was targeted commercials, public service announcements. We worked with OPM actually to get a blast out to retirees to encourage them to come back. And we've moved to really a more virtual approach, virtual hiring fairs rather than face-to-face hiring fairs. And as part of that, we were looking at trying to shift our time to hire approach in general. And because of this, we ended up making a lot of decisions in coordination with OPM and with our department to waive or postpone certain pre-employment requirements to really get us to speed up that hiring process. And we've been pretty successful in that regard. That surge that went up with hiring early on in the pandemic was key for us to get the word out to folks who maybe were transitioning military or people who had previously worked as medics and corpsmen on active duty, and we could bring those people in on temporary appointments. Those people who have that call to serve, we were really trying to target them and say, hey, now is the time. You can come back and even help us for a little while and then go back to your regular job down the line. And that has worked really well for us as we were able to hire many thousands of people using that approach.
Yeah, that's certainly very impressive. And maybe we'll come drill down on that a little bit more even. But Sheena, I want to talk to you for a second now. What specific challenges did Nara have to confront during this pandemic? And as I understand, the agency got about $8 million. So how did that, how did in the CARES Act, how did that help you accomplish the challenges that you have?
Thank you, Eric. I think one of the biggest challenges that not only the National Archives faced, but all federal agencies and even other corporations was helping our employees, all of our employees, work from home and work remotely. While we had some of our employees already teleworking, there are a lot of our jobs here at the National Archives that require people to come into the office. We have employees that physically pull records from shelves, scan those records in, and make them available online. Available online for the public. So that was one of our bigger challenges: is how do we actually help continue to digitize our records and make them available online, at the same time is providing the safety for our employees and allowing them to telework. The CARES Act really helped us in that way by giving us additional funds for equipment, electronic equipment for remote access. This helped us to buy additional laptops. It helped us to move some of our files that were previously on outdated equipment and move it to a cloud-based solution. It also helps provide for additional security monitoring as we move things more to remote access. There's different vulnerabilities, and NAR wanted to make sure that those things were secure. So the money really helped us to kind of upgrade our infrastructure in order to support the mass telework.
So as you were making those upgrades, what was the procurement process like? How did you, award contracts and in such a really tight turnaround like we don't usually see, often we don't see in government. And as you were helping employees respond to the new conditions in terms of the equipment that they needed, how did you distribute that given that a lot of people were at home? What was that process? How did that shake out?
That's a really good question. So the one big thing that I can say is that across federal government, we've all been working together. The OMB has held some CIO council meetings where we've met with GSA as well as other CIOs from across the government. And we've worked together to understand where were some of the pitfalls. GSA has helped us to really kind of make some of the purchases for laptops and other equipment faster. And if we had any roadblocks, they were helping us to move those things along. The really big thing is that we already had established acquisitions for laptops in our hardware, and we actually were able to expand upon that and just say, hey, we needed additional ones because of the COVID-19. Different acquisition things have been in process for COVID-19 and to allow us to move things faster. And so we're very thankful for GSA for that. And in terms of giving out the laptops, we're still in the process of giving those laptops out, but we have been able to make appointments, giving out personal protective equipment to our employees as well as for the people that are coming in to pick up those laptops. We've set up social distance stations where we can deploy those laptops. And even for our mobile devices, we've been shipping the mobile devices to employees at their residence and then working with them through the telephone to set up the mobile devices. We've also been able to use remote access within the laptops so that we're able to give people laptops and then remote in to help them with any ticketing, any ticket problems, help desk issues, as well as to just do basic setup.
Well, okay, so that seems like you encountered some challenges there, but impressive to overcome those on the fly. And on that, maybe I'll come back to you, Jessica, and maybe we'll hear from both of you. What lessons would you say you've learned during the CARES Act implementation and broadly during the pandemic? You mentioned some of the new authorities that you had for hiring, and some of these blasts that went out. What in that process have you learned that might become permanent, or just sort of inform your decision making in some way going forward?
That's an interesting question. I think we've learned quite a bit about how far we can push our hiring timelines, and that a lot of the things that we have historically done when we're embarking upon recruitment activity, they take as long as they take because of the volume of work we have or because we're used to how long they take. And people are accustomed to the idea that it takes a lengthy time in the hiring process, and so they don't worry so much about it. But when you're given a charge by your leadership, which we were, to get your onboarding timeline down to 3 days, suddenly you have to think radically different about how you're doing your business. And this has pushed us to do that because we had to. We were in an environment where we needed to have as many people, all hands on deck, as quickly as we can, because VA is not in a position to shut down its operations due to a pandemic. Quite the opposite. We're ramping up services to make sure that we are able to care for veterans and then ultimately for non-veterans as we had to expand our services as part of our fourth mission to be the backstop for the American healthcare system. So we were kind of shaking up everything that we ever thought we would normally do and asking the questions that normally we wouldn't even ask, I think. Requesting authorities from OPM that normally we would not have asked, looking at ways that we could write potential legislation to get temporary or ultimately permanent changes to how we do our business, and really looking across our organization to partner with other parts of the organization that sometimes we don't always have the best partnerships with, and this really pushed us. So for example, HR and IT were working really closely together to make sure that once we're able to onboard people and get them through our process, we have to make sure they have accounts right when they show up. And so we had to work really closely together to make sure that happened, or similar to what Sheena mentioned, making sure they had the right provisioning accounts set up, equipment, and making sure our bandwidth was in place to support not only people doing more telework, but also telehealth for us. So we are still providing care, but we use a lot of bandwidth to provide telehealth with video connections directly to patients. So we had to really shore up those relationships and all work together as a team, which is a great thing to see. So we learned something about our counterparts in other parts of the organization. We're also embarking upon a review of everything that we changed in our hiring process and documenting which ones were successful, which ones that we need to try to pursue through future legislation or policy changes, and which ones didn't actually make as much difference as we thought. So we're doing a review right now to see what comes out of it, with the plan that we will hold on to as many of those changes as we can, because there's really no going back once you've demonstrated that you can get people on board that quickly.
So you're conducting a review of these processes in real time. That's is that right, basically? Yes,
we are. So we had set up exactly because normally what happens in the federal space is that it takes a long time for us to get big changes to policies or procedures, and we usually have maybe even a year before a regulation is published and we're able to implement something. And in this case, we were doing it on the fly, and so we did a lot of documentation of what we were changing, how it differed from normal process, and now we're going back to look at each individual step to see which ones actually, what cut down the hiring process by 20 days versus only 1 day, and seeing which flexibilities were the most important to us.
Okay, Sheena, did I cut you off there?
Yeah, no, I was just going to piggyback off of Jessica. I think that we've learned some of the same things. The very big thing that we learned through this exercise is, just how resilient our organization is and how we're able to continue all of the things that we were able to do before while we were in the office, and we can do those now through telework, and how we haven't really had a drop in productivity. For the most case, for some areas we do, but for most of our workload, we have been able to kind of keep up with our productivity. We've also been able, very similar to Jessica, is our partnerships not only with acquisitions but with our human capital office as well, as we are doing the same thing as we're onboarding people. How do we get them the right equipment? How do we the right provisioning for their laptops, we have cards, our identification cards, to make sure that they're able to get into the right access to their equipment. So we're partnering with all of those type of people within our organization and working together. I think acquisitions has been a really big partner that we've had some lessons learned from. Usually it takes a very long time to get acquisitions through, and through this CARES Act and the COVID-19 situation, we've been able to move pretty quickly on our hardware purchases, getting additional support where needed, working with our acquisitions group and others to help write legislation, as Jessica was saying, or how we could do these things better in the future and not just during a pandemic situation. Being able to extend the period of performance on certain contracts, working with our legal teams, or if we needed to go back to Congress and extend our funding for another year, just because we've kind of lost some of that time. All of those things very similar to where VA has been doing. We've been documenting this as we go along to say, well, how can we do very similar activities as fast as we've been doing them now in a non-pandemic situation?
Got it. And Sheena, you just touched on this, so I'm going to follow up with you. That obviously Congress is looking at additional ways. We've seen some proposals, additional kind of stimulus packages related to the pandemic and the economic fallout from that. And part of that, I think, is likely to include additional emergency appropriations to agencies. Is there something that Nara would is that something Nara would welcome? Is there a need there for additional kind of emergency funding to address some of these issues?
Most definitely. So we moved very quickly with the first CARES Act just to make sure that we're able to have as much mass telework as possible. But now as we kind of look at our programs and working with our other program offices within the National Archives, we're looking to say what are some of these activities that we may be losing productivity on because they're not automated today. Again, there are some people who have to actually pull records from the shelves and they're scanning them in. One of the big things I know that VA, they're still working and having conversations from a health perspective with veterans. But we also have, and it's a very sad situation where we have veterans that do actually pass away from COVID-19. And as they pass away from COVID-19, their families contact the National Archives to be able to get their records so that they are able to have proper burial in a veteran cemetery. The National Archives provides that type of service. So we're looking to figure out how do we provide that type of service at the level that we still need to be able to provide that to the American public, but at the same time protecting our employees with social distancing. We are looking at how do we automate those processes because a lot of that information is in a paper record. So how do we actually kind of get that information scanned in quicker within the location that it is on a shelf? So we're looking at how do we automate those processes to continue that service. But we're also looking at other services that may have had a productivity loss due to everyone being at home. So those things that can't be done through telework. So we're looking at those. We're partnering with other organizations, not only within the National Archives, but partnering with other organizations as educational programs that definitely use our records, our different libraries, et cetera, researchers, and how can we better serve our researchers while they are at home and provide them with the same level of service that we would have if they were able to come into our buildings. So we're continuing to look at those, and if there is a chance to actually request additional funds, it would be for more automation, whereas the first one was more for hardware.
And what about at BHA, Jessica? Are you all sort of comfortable with where you are right now, or is there a need brewing for additional funding to address the pandemic?
We certainly have additional needs. I think a lot of the things that we're looking at right now are more other legislative shifts that we need to either extend authorities, because one of the other things that we worry about right now is, you know, a lot of the authorities we got are directly related to this pandemic, but obviously we have other issues that are happening at the same time. And if the national emergency is declared over for the pandemic, while at the same time we still are trying to manage what looks like a very active hurricane season, for example, some of the flexibilities we have, we're really going to need them for a longer period of time, and some we'd love to just make permanent in our ability to hire people in different ways, or even, you know, some of the other restrictions we have around our ability to transfer money across different parts of the organization. It's helpful for us to have as much flexibility as we can to be nimble. So we have other proposals in the works related to those types of areas rather than specifically asking for more money.
Okay, that makes sense. Just a reminder to the listeners, viewers out there, to get your questions in. We'll be taking those in a few minutes. We got a couple coming in, but otherwise I'll have to just keep talking myself. And while I do love the sound of my own voice, I would like to include others as well. So I want to turn to another part of COVID-related legislation. Congress sort of very early on in the process passed the Families First Coronavirus Response Act, and that specifically applied to federal agencies and in terms of the types of leave that employees were able to take. Jessica, what was it like getting this up and running so quickly, and what challenges has that presented? What does that process look like at VHA?
Well, it has been quite challenging, actually. It's difficult in that we don't often get new policies and authorities. We have to make sure that we understand what the new law requires and allows, get the regulations and the policy guidance, usually from other agencies, in this case, Department of Labor and OPM. And then we also have to make sure that our systems are in place to actually address what the new leave categories are, and we're still working through that on our end. It takes us a while to get updates made to our payroll system and our timekeeping system. So just the particular technical difficulties create some upheaval in the application of the new law. But broadly speaking, the broader concern that we have in VHA is that, as I mentioned earlier, we didn't shut down. And some of the provisions within FFCRA are really new leave entitlements with thresholds that a very wide part of the organization could potentially qualify for. For example, the sections that allow up to 80 hours of leave due to issues related to childcare. That's a healthy fraction of the workforce who might qualify for that. And because we never shut down operations, we really need people to be at work every day. And so we were looking at ways that we could try to support our employees by offering telework, flexible schedules, shift work, expanding our access to childcare facilities, where we created emergency childcare facilities on our campuses that we didn't have previously, really in order to help support our employees to be at work so they could provide health care directly to veterans. So there's been some upheaval in our ability to actually implement this clearly and consistently. We did work with OMB and OPM and Department of Labor to try and understand what our flexibilities are as a healthcare provider to make sure that we have the ability to exclude people from taking the leave if there are emergent issues that we need to have addressed for staffing at our medical centers. And so because of the complexity of how the law came out, I think we saw a lot of confusion where at the local level, people didn't necessarily understand what they were allowed to approve or not approve and what the provisions required. And also because when the law came out, it went into effect, and then we didn't actually have the guidelines from Department of Labor right away. And so that made it a little bit more difficult as well. So we are settling down and smoothing out now that we have a little time under our belts for how to implement FFCRA, but I do think there's probably some additional lessons learned about how challenging it is to have a law go into effect very soon after it's written without a lot of time for the policy analysts to really understand the implications, and also for our IT teams to code our systems to address it.
Yeah, I think certainly whenever Congress gets into the shoot first, ask questions later mode of legislating, it can create a lot of issues on the back end. And we're probably seeing some of that now. Sheena, what about you? Do you have anything to add to that?
So I kind of echo Jessica's sentiments here. I think from a congressional standpoint, I think we need to look at some of our policies and how do we create some of these streamlined processes that we have done now in the future.
Gotcha. So Jessica, you touched on this earlier, and maybe Sheena, you have some thoughts, or we can hear from both of you on this. But what is the challenge in, like, you've both sort of, especially at VA, gotten a new, extremely large injection of cash from Congress, and there's a sort of expectation that a lot of that is going to get out the door very quickly. So what are the challenges in that? I know neither of you are budget and part of the budget team specifically, but just in terms of the teams that you manage, what are the challenges in getting that money out the door, and how do you do so with a reasonable amount of oversight? Sheena, can you speak to that at all?
I guess on the VA side, we actually just had a budget hearing, I think, yesterday to talk about some of this. I think the broader challenge is that people still feel nervous when they get this big influx of cash, which is not part of the normal process. And so that they're not quite sure what they can use it for, and how it applies to their long-term budget. So the funding we got is good through the end of next fiscal year. So we are able to recruit people and pay for them through these funds. That I think that makes people a little bit nervous, but given the level of turnover that we normally have, you can recruit someone using this COVID-related funding, and you'll have enough turnover over the course of the next year and a half that it will be okay, and we'll be able to account for that in the normal budget process. Our funding was, the bulk of it was for VHA, but we had another big chunk that was for our IT team, and they are working very hard to hire staff as well, temporary staff to help support these needs, as well as expand our infrastructure. So just being able to decide exactly how you're going to spend that money. I know we asked for it for certain things, but then after you've asked for it, sometimes you identify new needs that you have. So we're still working through that and trying to make sure that we're doing it appropriately. I'm sure our budget folks could speak to that more coherently, but I spoke over you, Sheena.
Oh, no, you actually have said pretty much similar things that I would say. We're kind of tracking this money a little differently than we would have from our original budget request. We are making sure that as we spend this money, we can articulate what we spent it on, and how we spent it, and what were the benefits and things that match back to what we put in the CARES 2020 Act or our request. When we get the large injection of cash, I think the biggest thing is working with acquisitions and how we are able to spend it fast, and what acquisition strategies can we leverage. And I think that was working a lot with GSA to understand, is there any legislation that we can suggest or push forward in order to help us to streamline our process without adversely affecting the FARs, or doing something that the FAR would not allow us to do. So I think that the biggest thing is the large amount of money. It is working with acquisition. I think that is very similar to what Jessica said. As you get the money and what you originally thought you were going to spend it on, and as you go down the path to spend the money, you figure out you have these different needs. And so I definitely think that having the second stimulus, or the second ability to come back for another kind of CARES Act would be great, as we have identified additional needs. So we're still working through the acquisition process to spend the money as fast as we can, but to spend that money on the right things. And again, not adversely going against the FAR.
Yeah, it's definitely a pretty significant undertaking. I do want to transition to the Q&A portion. So just a reminder to the viewers that there's a questions tab located at the bottom of your screen. So click on that and submit a question, and we will try to get to those. So we have one question here from Arlene, who is based in San Francisco, it looks like, and she wants to know a little bit about actually what we were just discussing. So if you think you've already answered this, we can move on. But she wants to know, how does the CARES Act track money allocation and spending? Is that sort of publicly available in any way to see, where this money is going? I know obviously this might be a little bit outside of your wheelhouses, so let me know if this one isn't for you. But anyone want to take a stab at that?
I mean, I can take a stab. I do know that in terms of what every federal government agency has requested and asked for the CARES Act. I'm not sure if it's published anywhere. As it is in omnibus bills, it would probably be something that's available as you would in an omnibus bill for the Senate and the congressional laws that kind of go past. I will have some of that spelled out there, but yeah, this one's pretty much outside of me.
Well, it's interesting. Jessica was talking about trying to sort of in real time, and both of you have discussed trying to sort of learn in real time what's working and what isn't, how to stay within the confines of regulatory authority while also, using what is newly available. So that sort of in real time oversight does help provide some guardrails, I imagine, as you're trying to get this money out the door. And I will just put in a little plug for govexec.com. We've done some reporting on where this money is going, who requested what, so feel free to go on and give a search for the CARES Act. And you can find some of our reporting on this subtopic. So we have another question from Brian Myers, who is a program manager at FERC. He asks, how has your holistic approach to problem solving expanded during this pandemic? He's specifically wondering about security and insider threats, but given the missions that you guys have, perhaps you can just speak more broadly about how do you ensure that you're taking a holistic approach as you tackle some of these problems that the pandemic has raised? I know, Jessica, you've talked about how you're asking questions that you don't even normally think to ask. So what is that process like? How do you deliberate that? How do you include a lot of perspectives to sort through these problems?
Well, I guess for VHA and maybe for VA as a whole, one of the things that I think has been really helpful for us is taking a command center approach. So last year, when we had a huge law, the Mission Act, that we needed to implement, we had about a year to get ready to implement that law, and a lot of people were working on the individual components of that law that they needed to address, but really, we didn't really start gelling as an organization until our leader, Dr. Stone, brought us together in our Healthcare Operations Center to have daily, sometimes multiple daily meetings where we're all looking at the same data and tracking towards the same goals. And we included people from across the organization who, again, normally would operate within their own silos. And we brought them together to solve problems together. And that approach and that relationship that was built through that approach is similar to what we've implemented now. So we have, again, it's not just what's happening within VHA or the Healthcare Administration, but we have people from IT and from the General Counsel's office and from acquisitions, all on our daily calls where the field leaders are involved. We all look at the same information and people jump in and start figuring out how we can solve problems together. We also jumped in and asked our field leaders, what would they need? What does it take to solve some of these problems? How do you look at trying to be swift in your recruitment? Or what authorities do you need that we can temporarily ask for exceptions to? And we just started making lists of everything we could think of, even if we said, there's no way someone's going to approve us to do this. And lo and behold, we got approval for some of those things. So we just shot for the moon pretty much and asked for what we wanted and got a lot of success in that regard. So when we're looking at things like security, the question was about, internal security, but, we also look at that from a pre-employment perspective, and a lot of the policies and regulations and laws that we have in place in the way that we think about vetting our employees are put in place to eliminate risk, right? To get rid of bad actors and make sure that we're not bringing on anybody who's not fit for federal service. And we obviously have to keep looking all the time at what's going on to make sure that we keep the best people on board. But when we really start looking at what things can we waive and push and appoint people on a temporary basis And if we continue their security process and identify something within the first 120 days, then we are able to swiftly remove them from federal service. What fraction of them do we actually have to do that with? So that's what we're trying to look at right now, given that we brought people on with temp authorities. What fraction of them do we actually find a problem with? And that helps us evaluate the risk versus the benefit of quickly hiring. How many are actually not the best hires? So we're trying to evaluate that now to see what the ROI is of taking that approach.
And I guess ours is a little bit different. I mean, I'm taking it from a different approach. I'm taking it more from a cybersecurity approach in terms of incident responses. But with like large scale continuous telework by employees, it increases our internet traffic, which requires us to have additional resources to monitor and respond to incidents. And so we wanted to make sure that we're taking all these things into consideration, and that was one of the things we did use the CARES Act for, was to increase our monitoring and our approach to being able to respond to those kind of security incidents. So it also increases our phishing attempts for people to say, hey, there's this COVID-19 thing, and our employees will click on it. So we're creating more communication, we're creating more training. We just sent out like a really fun game for people to play, which kind of has like a picture, and you pick where the security vulnerabilities are. So we've increased our training, our monitoring, how we respond to these different things, and also creating plans to mitigate any of these attacks. So from a cybersecurity standpoint, that was one of the things that we're continuously doing with the CARES 2020 funding.
All right. We are almost out of time here. We do have, let's see, one more question that just came in. Maybe, Sheena, you can talk about this since you've a little bit discussed the need for additional funding. How do you make that justification, as you're making a pitch up the chain of command and then eventually over to Congress? How does that process play out to make sure that your voice is being heard and your needs are being met?
This was a really good question. What we did was we canvassed the whole organization. So very similar to what Jessica said, all of our executive teams meet. So it has someone from each of our program offices, as well as budget, IT, human capital, and acquisitions. We asked the staff to kind of go back, kind of look at any of the things that could be automated and help with COVID-19. What we then did was have everyone put together their proposals for these items, given a description and a justification and how that business need fit for COVID-19, why it was something that couldn't have been done outside of the pandemic. We made sure that we had a cost estimate and a timeline. So a lot of these funds means that they have to be, the funds have to be spent pretty fast, which means these automated solutions have to come in that same timeline in order to reap the benefits of it and have some type of cost benefit analysis. So all that was taken into consideration as we put in these justifications. We also looked at our current processes to say what's the impact of maintaining that status quo, and then what was the goal or the target state that we were trying to achieve in this small time frame. We submitted those packages up through our chain of commands, and we reviewed them as an executive team to say, okay, what would be the biggest return on investment for the National Archives in terms of supplying this information to our researchers or to other federal agencies, to our employees, or to the American people. And we went through those, and also a lot of it was the timing. Could this automation be done within the next 3 months? Or would it take longer? If it's going to take a year to get this system implemented, then it won't help us with the COVID-19 situation, and those things are not going to be taken into consideration for this funding. So that's kind of the thought process that we went through for the additional supplemental request.
Great. Well, that is just about our time. It's really fascinating to me to hear about when these sort of forced disruptions to the status quo come into play, how it can lead to better outcomes. There's certainly a lot of that playing out in our society right now, and you all have illuminated some really interesting perspectives on that. So that will conclude our session today, our fourth session of today's summit. Thank you so much, Sheena and Jessica, for taking time out of your really busy schedules to join us. It's really been a great conversation. Our next session is going to be called Your Endpoints and Networks Have Left the Building. This will feature Andrew Stewart and Sean Frazier at Cisco Systems, who will be in conversation with James Hansen, Vice President and Publisher of Nextgov, which is our sister site at Government Executive Media Group. But now it's time for lunch. So during the lunch break, we encourage you to visit the exhibit hall and the chat room, say hello to some colleagues, and then we'll see you back after the lunch break for our next session, which is at 12:40 p.m.